I'm foot.doc.dana and I'm a podiatrist, which is a foot and ankle specialist and surgeon. Today, I'm going to debunk some of the top myths about foot health. First myth is that cracking your foot joints is bad for you or causes arthritis. The reality is, cracking your joints makes a sound that's just the gas bubbles being released from the synovial fluid. It does not cause any damage and it does not cause arthritis. It's not linked to arthritis or any foot deformities like bunions or hammer toes, so crack away without worry. The next myth is that foot spas can detoxify your body. Here's the facts. Your liver and your kidneys are for detoxing, not your feet. If you've seen any videos with before and afters of foot baths where the bath is really dirty, that's actually just rust, not toxins from your body. If you have one of these and you don't believe me, try running it without your feet in the water. You'll find the water looks exactly the same. But if you like soaking your feet just for the spa effect, then go ahead. The next myth is that high heels and footwear are the only cause of bunions. Some people are going to be mad at me for saying this, but bunions are mostly genetic, and I think it's time we stop shaming women for wearing high heels. Yes, there are lots of negative health effects of heels. For example, it causes muscle imbalances, it can predispose you to falls which injure your ankle, etc. However, it does not cause bunions. It can make your bunion pain symptoms worse, but like I've said before, bunions are mostly genetic. Another myth is that only females get bunions. The reality is both men and female get bunions, although females get them more often. I would guess that about 90% of bunion owners are female and 10% are male. I also think part of this might be women are a little bit more likely than men to come to a doctor for treatment of their bunions, and people that wear tight shoes and high heel shoes are more likely to have a painful bunion, and that might be another reason women seek treatment for bunions more often. The next myth is that cutting out the sides of your toenails or cutting it in a circle prevents ingrown nails. But the reality is, to prevent ingrown nails, you should be cutting your nails straight across rather than to the side. And fact is, if you have recurring ingrown nails, you might need to see a podiatrist to get a permanent procedure done to fix it. Next one is that foot calluses mean poor hygiene. This couldn't be further from the truth. The reality is, calluses is your body's attempt to toughen up your feet. Anytime there's a part of your foot that has more pressure than all the other parts or an area of friction, a callus will start to build up as a body's natural defense mechanism. However, our bodies can sometimes go overboard and build up way too much of a callus to the point where it's painful or could even cause a wound underneath. So no, calluses do not mean poor hygiene. Next, some people think that toenail fungus only affects dirty nails. But the reality is, fungus does not discriminate by cleanliness. Instead, it just thrives in warm, moist environments. So it's actually most important to keep the nails dry and avoid areas like public showers, public pools, where there could be fungus. Also, people that are immune compromised in some way are much more likely to have nail fungus than others. Next myth is that cutting the nail cuticle is necessary for clean nails. This is completely false. In reality, the cuticle protects things from getting in your nail and can prevent infection. So if you're getting a pedicure, rather than having them cut off the cuticle, ask them to gently push it back instead. Next myth is that once you're an adult, your shoe size doesn't change. Wrong. Your shoe size gets bigger for a couple reasons. Big one, pregnancy. For one, because the feet tend to swell, but also your ligaments relax when you're pregnant. And yes, this can make your feet up to a size bigger. Similarly, weight gain or weight loss can change the size of your feet, and people's feet tend to get bigger as they age. So yes, your foot size can change a lot after you start adulthood. Some people think that athlete's foot only affects athletes. Not true. The term athlete's foot is a nickname for tinea pedis, which means a fungal infection of the foot. It has the nickname athlete's foot because athletes are just more likely to get it because they're more likely to share showers, locker rooms, places where people put their feet, and it's a moist environment perfect for breeding fungus. However, it can happen to anyone, not just athletes. You know you might have athlete's foot when you have itchy, scaly skin in what we call a moccasin distribution, which just means on the bottom of your foot where a moccasin would touch. The best way you can prevent this is not walking barefoot in communal areas. Also, keeping your feet dry, changing your socks often, and keeping good foot hygiene. If you do have athlete's foot, antifungal creams usually work pretty well. The last myth is that foot pain is normal as you age. In reality, you should not have to suffer with foot pain. Aging doesn't mean you have to endure foot pain. It's not normal at any stage of life, and it could be a warning sign for an underlying issue. So if you have foot pain, one of the first things you want to do is make sure sure you're wearing good footwear. And if you are, you might want to consult a podiatrist and see if anything else can be done and if there's any issues with your feet. I hope you guys enjoyed this myth-busting episode. Leave comments down below on what videos I should make next. Make sure to like and subscribe. Bye.